In the assessment center, we are seeing people every day who are experiencing symptoms of COVID. We're also seeing people that have come in having had contact with confirmed COVID cases. I can see the look in their eyes, the uncertainty. They don't know how this is going to affect their health or their daily lives.
As a lab technician, we get to see the patients firsthand in the morning, and we really see the fear and anxiety that they have because they're expecting a result right away, and we're doing our best to get that result quickly to them. The blood samples and the swabs that we're processing are not just a sample, it's a patient's life. It's their job that's potentially is put on hold because they're at risk to their coworkers. It's a family member that's left behind. Because of COVID restrictions, these family members are not able to come in and see them.
What we see when we transport patients is anxiety, fear, they're alone, and they don't know what to expect, and they are isolated. For the patients and their families, it's a very tough situation.
We are seeing an increased number of elderly patients that are unfortunately dying alone without anybody to visit or to hold their hand. When we talk to the families, it's mostly over the phone. The families of COVID-positive patients are not allowed to visit at this time. They are very anxious, emotional. They check in frequently through the night. Just because they're worried, they cannot sleep. Their anxiety level is so high. I think for the staff, also there's that level of anxiety still. If you do get exposed or let's say ventilator becomes disconnected and you're showered with COVID virus, there's level of fear. Did I get infected? Did I get exposed?
We see these people come in scared. There's a whole new insight when they come in. There's a harsh reality that people have to face. They have to face it, and their families have to face it. And of course, we have to face it as well. We have to incur the risks of providing the care for these people. Let's all conduct ourselves so that when we look back upon this pandemic, and there will be an end, let's look back with pride on how we conducted ourselves individually and collectively, knowing that we put others' interests above ours for a limited period of time, and then we can all have what we want, but later.